This is a reaction to Mizkif's video called I Finally Got a Hair Transplant.
Today's the day of the hair transplant. It's currently 8 o'clock in the morning and I'm very tired.
Oh, it's 8 o'clock and it's the day of his surgery? I don't know, in my clinic I start at 7 a.m. for surgery, so if a patient's still in bed at 8 a.m., it's not a good sign.
I'm gonna have myself a nice chicken Caesar wrap.
Usually I recommend that patients eat light if they're gonna eat something for breakfast. It is a good idea to eat something, but chicken Caesar wrap in the morning for breakfast before we even start surgery, that might be a little too heavy. But, you know, everyone decides for themselves. It's just that you're going to be in a flatter position for, part of the day and even on your belly for a part of the morning. So it might not be good to have a stomach full of food.
Put on my little feeties, button down. The reason why I have to wear this is because I have to take off my, I can't pull over the shirt over my head after the surgery.
Yeah, you can also wear like a zip up as well. That's fine. Many patients will actually not read that instruction and they'll just show up with a t-shirt, and we advise them to either remove the t-shirt and wear the surgical gown, or they can actually wear the t-shirt but then they have to cut it off next day or whenever they decide to change clothes. So yes, trying to take a t-shirt off like when you have grafts on top of your head, not a great idea after surgery.
I'm really not nervous. The way they described it yesterday made it seem pretty easy. I do know it's going to really hurt for about 1 minute.
Yeah, hair transplant surgery doesn't have to be a very painful process if it's executed properly. It can be rather comfortable. It is a long day, so you definitely have to be prepared for just being in a chair for a long time, but it doesn't have to be uncomfortable or unsafe if it's done properly.
I'm actually getting a hair transplant. Do I seem calm?
Yeah, you seem calm.
Cool.
Are you calm?
No, I'm panicking.
Most patients show up a bit apprehensive, a bit nervous for the surgery. There's usually some excitement there as well, but usually more nerves than excitement at the start of the day. But then they realize it's not so bad, and people usually calm down and have a nice experience. Also, we give medications like Ambien and Valium optionally to patients, and that also definitely takes the edge off as well.
Do you think I'm going to be beautiful after this?
You're already beautiful.
Oh, that's the right answer right there. So hopefully the camera that she's holding like on her phone is not the only way that they're taking their before and afters. I'm sure they have a more robust camera for taking those images, but maybe secondarily they also take some images on their phones.
What did it look like?
He looked bloody.
Really? I thought they said no blood.
It depends on the person.
What if yours is like a ketchup packet?
Oh no, that's not good.
Yeah, the amount of bleeding just depends on how thin the person's blood is, and of course the extensiveness of the procedure. So if you're working on a small area, there's going to be less bleeding. If you're working over a broad area, whether it's the donor area and or the recipient area, of course, then the bleeding is going to increase overall. But the amount of blood loss over the course of the day is somewhere on the order of maybe 20 to 30 cc's, which is like 2 to 3 tubes of blood. And then if we're doing PRP, that's another tube of blood. So that's about how much blood overall people lose, but it just depends on the individual. And remember, this is blood loss over the course of an entire day. So that usually doesn't result in any major hemodynamic changes in the body.
Okay, so that's kind of your midline here. As we discussed, really just kind of thicken up along these.
Yes, it's important to start right in the center to get the height of the hairline properly set before designing the rest of the hairline. But that central position is very important to confirm with the patient, to make sure they're happy, to make sure that the horizontal thirds are there as far as facial proportions. All of that matters.
Ultimately, it's not going to be a perfectly straight line like that.
Right.
I'm going to draw it straight on both sides to match it up. Mm-hmm. But then once we actually do it, it's going to kind of zigzag a little bit. Like I said, there's going to be some like loose hairs kind of scattered through there. So there's a nice transition.
My preference is to use small dots so that I can force the regularity in between those dots rather than having like a straighter sort of line drawn. But everyone does it differently, and there's definitely possibilities to create a regularity even if you draw a straighter line like he's done here.
I didn't want anything too crazy because I don't need it.
It's always safer to create a more recessed look than it is to go for straight. But of course, every patient has his and her own preference. So I think it's important to check in with the person to give them some options for how especially the corners can look and how it can blend into the temple area. I think that's really critical. There's not just one way way to do it. There are usually a few options for how to create that transition over from the center into the sides.
Do you think it should go down more, or do you think this is good?
I don't think so.
So again, it's easier, I think, to set the central height first before starting to draw out lateral, because once you've started to create these lateral drawings, now you have to erase all of that if the person is not happy with where the center is set. So my approach is usually to spend a lot of time with just creating literally one dot right along the center of the forehead, just based on where we want to place the hairline. And that is a big first step, in my opinion, as far as drawing the hairline.
So from the chin to the tip of the nose, you're at about, what is that, 9 centimeters? So, and that's about 7.
Typically, if you're looking at the horizontal thirds of the face, which I think is what's going on here, it's going to be the subnasal area. So the base of the nose to the bottom of the chin is the bottom third. And then the middle third is going to be the base of the nose to the glabella. And then from the glabella up to the hairline. Those are your thirds.
Actually, that's, if anything, a low hairline. 8 would take you up to about there.
The thing is, he has a lot of roundedness to his forehead, and that's going to create the illusion of a higher hairline. So you can't always depend on these horizontal thirds as far as getting your hairline and setting your hairline. I definitely applaud the surgeon for wanting to be more conservative, but I think also working with the patient on where they might want the hairline, especially accounting for that curvature that he has, is really important here.
If you shorten this more, it might look like you have too short of a forehead. So
I trust you.
This is a solid position, and like I said, raise your eyebrows all the way up and down. Yeah, you don't want that to approach the this frontalis muscle.
I think it's always safer to stay higher on the hairline. And anytime I post a before and after and there's a result where the hairline's a little bit higher than where some people would place it, I always get the commentaries of like, oh, his hairline is still too high. But at the end of the day, you want to try to keep things safe for patients. It's always possible to come back and go a little bit lower with like a secondary procedure than it is to come back and bring the hairline back up. That's always more tricky. And for that, you would need either like laser hair removal, which is tricky to get that done properly to remove part of the hairline, or you can FUE out those grafts, but then you have scars from doing the FUE, so that's also not an optimal choice. So again, always safer to stay a little bit higher.
The fact that you're starting to see through a little bit here means you've actually had a decent amount of hair loss. Okay? But the good news is we can thicken this up medically.
Yeah, I mean, I'm always talking to patients about medical therapy. It's so critical. Most of my surgical patients are also on medical therapy. Minoxidil, finasteride are like the mainstay, as you guys know. We've had these medications available on Feel Confident for 2 years, over 2 years now, and patients overall are very pleased. And then, of course, once you're there, maybe check out the shampoo, conditioner, thickening foam, all those good things to also support your hair health.
If I pull his hair back, right? It's like, how far back can I start seeing through? Like, where do we need to reinforce it?
Yeah, that's pretty much what I usually do. I also hold my hand like that to see how far back I need to work.
I wonder how it's going to go. We'll see.
So in my clinic, I start with the site making first. And then once we know how many grafts we need, then we go to the back and do the full harvest. Before we start making sites, we actually harvest about 4 or 5 grafts from the back just to get a sense of the caliber of the graft, so that when we go and we start making sites, we can match up the caliber well. Otherwise, it's a little bit of guesswork. Also, if you start with your harvest first, then you're kind of also guessing how many grafts you need into this area. Even though now the markings are made and all of that, it's still not clear to the doctor, I'm sure, exactly how many grafts he can get in there. At least to my team, you never know exactly until you really start making your sites. So that's the way I like to sequence things, but some people just like to get the harvest out of the way first. And then even if they need a bit more on the graft side, then they might come back to it later. I find that that's harder to do. Keep in mind that in terms of graft count, every centimeter at the hairline can consume like 1,000 grafts if you're going for maximum surgical density. It depends on the hair type and, different factors, of course, how much, baseline baseline hair they already have there and the caliber of the grafts. But let's just say like up to about 1,000 grafts. So now if they're working back beyond just that centimeter strip, but they're going back and they're layering hair in, most likely he's going to need, anywhere between, I would say, 1,200 on the low end for the area that they've marked out, up to maybe 2,000, maybe 2,200. I don't think you can squeeze in a lot more than that into the area that was marked.
We're gonna numb up this area, get it nice and numb, and then we'll start making the openings for the new grafts that are to be coming in.
So it looks like they are going to start with site making first, which I think is a great idea. They haven't done any sampling yet of the donor area. So I guess in terms of the sites that they're picking, maybe they're just picking the sites that usually work best for them in most cases. And that's a fine approach too.
This does not put you to sleep. It just helps you kind of relax.
Oh, I wasn't even anxious.
This is the Pronox system. It's like laughing gas. I think it's more hassle than it's worth. I think if you just talk people through and use a little vibration device when you inject, and injecting slowly and injecting off of like using a small syringe and a small needle, all of that is what leads to a pretty comfortable process for numbing the patient. So I don't find the need for this Pronox system.
Here comes the injections. This one shouldn't be as bad. Maybe just a little pressure. How's that feeling?
We also use a more concentrated lidocaine solution initially, and then we switch to Marcaine, which is the longer acting numbing. So similar to what this surgeon is using.
So to describe that pain, because this is the phase 1 of it, which is what they said is the most painful because I shouldn't really feel anything else, it was probably like a 2 out of 10.
So now it looks like they did not shave the recipient area. And oftentimes when we're working on hairline, it's possible to just leave it as is and work around the hair. And that's okay. Sometimes for accuracy's sake, we do request that patients let us do a little bit of a shave, at least in the area that's marked out. But not all patients are okay with that. And that's okay. We can work around that hair. There are certain cases where it's beneficial to actually shave the whole head. But in this case, they've basically shaved the donor area, but they've left the recipient hair longer.
That's a big part of it, just like creating that comfortable environment.
So when I make recipient sites, I'm mostly sitting. Sometimes I'll stand, but usually I like to sit behind the patient's head and be comfortable and adjust the chair positions to get the right angles. But again, every surgeon has his or her own ways of doing it.
I didn't feel it anywhere else, but one area was like basically really bad.
Yeah, over the course of the day, usually you have to re-numb patients, and sometimes some areas just have more nerve endings and require more anesthetic. That's normal. And we have a stronger concentration of lidocaine at 2% that we use only when we need to. So we'll try to dilute the lidocaine because, again, one of the biggest risks of hair transplant surgery is lidocaine toxicity. So the more you can do to limit that risk, the safer the overall process is. So we'll only use the 2% when it's truly indicated and warranted. So if I inject our initial numbing and the patient still continues to feel pain, then I'll take out the 2% in low quantities and we'll use that in the area, and that usually makes the pain go away.
Please lie down on your stomach.
So it looks like they just finished the recipient site making. Now they're going to be doing the donor harvesting.
Okay.
All right.
Now I'm stuck like this for an hour and a half. I can't watch Netflix.
That really is usually the worst part of the whole day, is like that head down position. But that's kind of how it goes. That's part of doing hair transplant. There are some places, I know there's someone in South Korea where they'll do the harvest with the patient in a more seated position. So they have a special type of chair where you have basically like a forehead rest, and they'll use that, and they basically will be harvesting kind of standing up like this from the back. That's another methodology, but that's not something that I've seen done in the States.
Oh yeah, that hurts.
I know, this is worse. Sorry.
For some people, the back is more sensitive, and for other people, it's more of the front. But in recovery, when people report some heightened sensitivity, usually that's coming from the donor area.
This is obviously a bigger area than the area we're filling.
Yeah.
But that way, we'll just leave enough hair behind.
It's important when doing FUE surgery to keep the donor area fairly wide and to harvest from a broad zone, as opposed to just like harvesting from a little tiny strip. Because if you harvest from a little strip, you're going to over harvest from that small area, and you're going to create the appearance of some alopecia in that area, which is like defeats the purpose of doing FUE surgery.
The first one I didn't really feel at all. The second one was really rough.
Yeah, there's a lot of variability in how people perceive pain. So, for some people, again, with more nerve endings, you might just feel it more in certain areas. This clinic Mizkif went to, I'm familiar with them, and they were a big artist center. So that's that robotic device that does the harvesting and actually has some capability of doing some recipient site making too, though very few people use it for that. But it looks like maybe they transitioned over to using this kind of handheld motorized system. We use the WAD device, as many of you know. They're using something a little different here, but it's of that nature as opposed to that big robotic system. So interesting that they changed the course on that, or perhaps they still use the robot and on some patients they use this system. I don't know.
Not yet, you're almost there.
So we'll see later if they report on the number of grafts. I'm curious how many they harvested in this hour and a half or 2 hours that they were doing the FUE harvest. So people who harvest very well as far as FUE can get up to, I would say, 1,000 or even 1,200 grafts an hour is a very fast rate. It's a very good rate. And others, when they're starting out, or if it's a very difficult case, your numbers might drop down even as low as 300, 600. I mean, when you're just per hour, when you're just starting out, it takes time to build up to those faster speeds and higher harvest numbers. But also the biggest thing, it's better to take longer and to have a low rate of transection. Transection is when you're actually cutting through the shaft of the hair. So the bulb where the actual life of the hair is, if you're cutting through it accidentally and not capturing the full graft, well, that's not good because then it's not going to grow well in the new location. You want to be efficient, but you want to go slow enough to be able to avoid transection or keep transection rates extremely low. So again, you want to be fast, but you want to be slow at the same time because you're trying to do it well. You don't want to get 2,000 grafts, but poke 3,000 holes to get those 2,000 grafts. You want to get as close to poking 2,000 holes as possible for those 2,000 grafts.
6:06 p.m.
They skipped the part about the implantation, right? So after they were done with the harvest, then it was time to place those grafts into the recipient area. And then, so I guess they just finished that. It's about 6 p.m., which, usually we finish up the day between 5 and 7 p.m. So 6 p.m. is very standard for the end of a hair transplant. It takes all day. Takes a team to do this type of work, as you're seeing here. That's very normal.
The purpose of doing this on the scalp, just to kind of decrease any local scalp inflammation.
This is interesting. I haven't seen data to support the use of cryotherapy immediately post-op. I would, of course, I'm always worried about graft viability and all that, but I'm sure they haven't seen that problem. And maybe they're seeing some benefits to using this type of therapy.
This is called cryo-PRP, what we're doing, by the way. So we're doing the cryotherapy followed by the PRP.
So our PRP gets placed before the actual grafts get implanted. That's when we put our PRP in, so usually in the afternoon. And then I guess they're going to do this cryotherapy and then PRP at the end. The order of it doesn't really matter too much, but the only concern with placing PRP after the grafts are in is that potentially you could kind of pop out some of the grafts. So my preference is to place the PRP before the grafts are implanted.
My hairline looks kind of messed up, but it looks really good.
So some patients go home with these types of bandages from different clinics. My preference is to send patients home with no bandage. I find that it's just kind of in the way, and I worry that if someone goes to adjust the bandage, then maybe some of the grafts will get impacted. And then if the bandage is all the way on the back as well, as they go to remove that on day 2 or 3, they could potentially pull off some scabs and then get some bleeding from, let's say, the donor area, and then be worried at home where I can't help them as easily. So we leave patients with no bandages at the end of the day, and we just make sure they're not bleeding, send them out, and they do great.
I did use the spray they told me to use. I still feel good.
Yeah, we give patients a Plasmolite ATP spray that they use the day after surgery. Probably this clinic gave him something similar.
I look like But it doesn't hurt. There's been no pain, which I'm very surprised about.
Remember that the swelling tends to accelerate into like day 2 and 3. So the day after, you might not have that much swelling, but then remember that it can get worse and it can start to, and usually it descends down the face. So I've had some patients where their entire eye swells up, and this type of bandage does not prevent that swelling from dropping down.
Today is day 2 of the surgery. My hairline looks a little better. My head is definitely still swollen. I could feel it.
And we put out a video recently about one of my patients and his full recovery. So full 10-month recovery, week by week, month by month, progress, photos and videos and everything that he recorded. So check that out if you're trying to understand like how will you look at like, let's say 1 week after surgery or a few days after surgery, or let's say like 3 weeks or 3 months after surgery. So we're going to put that video at the bottom here. So make sure to check it out.
No, it's really easy. I've had no problems. It's kind of nuts. And now I do this for about 5 days where I put this on the back of my head. Every 2 hours I use this product. I don't know what it is called H2Ocean.
We have a video about post-op care as far as like what my patients get after their surgeries in my clinic. So make sure to check out that video as well.
So you can see the little freckles that are inside my head. That is the scabbing.
So they didn't really tell us how many grafts they implanted. I think it would have been nice to know that. But maybe Mizkif will tell us in a different video.
I feel great. Still have to wear this do-rag wherever I go.
So from an FUE procedure, there's no scarring in the front. The scarring will be on the back of the head once he heals up from those FUE punch sites.
It was kind of tough to sleep at night. I know that this is just temporary, but the scabbing is really not bad. I mean, if you take a step back, you wouldn't even notice I had it.
So thank you to Mizkif and to his surgical team for sharing his experience. It's always very brave of everyone to put themselves out there like this. It's not easy, as I know from personal experience as well. Keep in mind that every surgeon has his or her own preferences and ways of doing things. There are many ways of doing things well. And then there are, of course, ways of doing things not so well. But overall, everything I saw here was done very nicely. And I'm sure that he's going to have a nice outcome. And we'll follow closely for results.